Good evening, and welcome to the webinar by Howie Akers, How You Diet this evening. The webinar topic is strengthening your immune system, and we're excited for the program that we have for you tonight. Dr. Olin Idol will be with us, and it's just an incredible presentation he's put together, and we know that you'll be blessed by it and really help not only yourself but also the people that you work with. Before we get started, why don't we just open in a word of prayer? Dear Lord, we just thank you for this opportunity to share this information and to honor you and what we do here. We pray that you'll bless us, that you'll guide us, and that everything goes smoothly. Bless Olin as he presents this evening and give him the words to say, and pray that people are able to understand everything smoothly. We love you and honor you in Jesus' name. Amen. So to get right to the message, as Olin has for us, you know, Olin's been with How You Diet now since basically 1994. He came to the first health ministry training, and he studied health and nutrition for a number of years. And you know, he got his naturopathic degree. He's a health consultant, certified health consultant. But he's done research with him and Dr. Donaldson over the years. And some people would call terms that they use for Olin is brilliant, a mastermind. His approach is simple, yet it's quite effective, and he helps people on a day-to-day basis regain their life, basically, by changing their diet. And he's one of the most renowned people that probably understands how the body functions and what it really takes to achieve health, not just in the short term, but in the long term. And so it's really a privilege to have Olin with us this evening. And Olin, I believe you're on the line, and thank you for joining us, and take it away.
Thank you, and certainly good to have everybody with us this evening. I hope everybody enjoyed a blessed Thanksgiving, and we're entering this time of year when we want our immune system at the top of the game so that we can be resistant to all of the bugs, the viruses, bacteria that we're encountering. You know, a lot of us have children and grandchildren that are attending school, and they sit in that enclosed environment all day and exposed to all types of viral and bacterial issues, and we want to help keep this immune system strong. You know, God provided us with an immune system that is designed to keep us well, but as we have learned, many of us the hard way, we have to do our part so that immune system functions as He intended it to. We want to, as we look at the immune system, we want to look at a comprehensive approach. As I tell folks, diet and lifestyle is always foundational. You know, we live in a day and age when people want to find a supplement, or they want to take a medication or a drug that's going to take care of the problem, and it just simply doesn't work that way. We've got to have the proper foundation, and then we've got to have the proper complement. So our diet, lifestyle, and specific nutritional supplements, how we handle stress, getting the appropriate amount of exercise, all of these are very important aspects of providing the conditions for optimal function of the immune system. As we get started, we got just a little brief poll here we'd like you to click on quickly so we can see where we're at as far as how are you following the How Do You Diet, if at all. So let's take just a second, if you would, and answer those questions. As you are responding to those, we'll look just a little further in a minute at our genetic makeup and how genetics come into play in dealing with how we support our immune system. I think we will, most people have had a chance to answer that one. We'll move along here to the next slide and may refer back to these results a little later. You know, often when we have a physical issue, we're told it's related to our genetics. And I think, you know, to be honest, we really need to take a look and see what the role of genetics is. We, as individuals, can have a genetic weakness and have a propensity to come down with some type of illness. You know, as Reverend Malcolm was mentioned back over 40 years ago when he had colon cancer. His mother had colon cancer, and they would tell him, you know, genetic predisposition that he had it. So does genetics really play a role in this whole deal? And I think Dr. Dan Chestnut, who is a medical doctor, health minister, I think he puts it in very good terms, and I'll just quote him briefly from his book, Lying with Authority. Dr. Dan said, genes control everything in our body. They can cause disease when abnormal, but not always. So what controls genes? Nutrition can control genes. For most genes to become active, to be expressed, something in nutrition triggers it, bad or good. Good genes that can boost immunity, activity can be expressed by good nutrition, and that's good news. We know for sure that harmful genes can also be activated by animal products, especially cancer. And we're learning today that, what you and I are eating today, the diet, the nutritional supplements, the toxins we're exposed to, will have an impact on our children as well as our grandchildren. So we are reaping the harvest of what our parents and grandparents did nutritionally, and the toxins they were exposed to, and then our children and grandchildren are going to be the beneficiaries of our good nutrition and proper supplementation, or they're going to reap the harvest of our poor choices. Along with the genetic aspect, the form of birth that we had, whether it was a natural childbirth or we were delivered by cesarean, will have a strong impact on our immune system, and it'll go back to our genetic makeup. So when we look at our genetic tendencies and the way we were delivered, the next thing we want to consider is when the baby is born or when we were born, were we allowed to breastfeed? Unfortunately today, a high percentage of births are by cesarean section, and many of the mothers choose not to breastfeed the infant. And if we have a cesarean birth and we're not exposed to mother's colostrum right after birth and breastfeeding, then we start off with a negative potential for a good immune system. We don't inherit the immunity from mom as we should. We don't get the benefit of the friendly bacteria that mom had to help us get off to a good start. And when we're speaking of bacteria, we're talking about the microbiome, or the bacterial makeup in our body. It's interesting, they've come to learn in recent years that we have more bacteria cells in our body than we do cells. We have as much as 10 times the bacteria in our body as we do human cells, and we have somewhere near 100 trillion cells. So we are host to a tremendous number of microorganisms, and the type and number of organisms that inhabit our body determine to a great extent how our immune system is going to function. And as I said earlier, our genetics, our birth, and our ability to nurse at birth has an impact on the type and the amount of bacteria we have in our body. Healthy adult, we should have about 3.5 pounds of bacteria. That friendly bacteria should make up about 80% of the bacterial population that we're host to. The other 20% is potentially pathogenic, but as long as we keep our friendly bacteria predominant, the pathogenic bacteria are not able to take hold and present problems. It's common for us to have the strep bacteria in our throat, but we've got enough friendly bacteria that keeps that at bay so that it doesn't manifest symptoms. It's a normal inhabitant of the upper GI tract there in the mouth and the esophagus, but it doesn't cause us problems as long as our bacteria, friendly bacteria, are in a high percentage of the population. And as I said, the type and number of organisms determine our immunity to a large extent. Now, and how do we have a positive impact on those microorganisms so that we will have a healthy immune system? They tell us that about 80% of our immune system resides in the gut wall, and we want to have a positive impact on the type of bacteria and the amount of bacteria that resides in the gastrointestinal tract. Fermented raw vegetables is one of the most economical and efficient ways to keep that friendly bacteria boosted up, keeping it in a predominant position. Very easy to ferment raw vegetables. We can ferment sauerkraut, pickles. We can make salsa with peppers and onions and various things like that. Put it in a quart jar when it's prepared properly, and lay a a lid on it, not tightly sealed, and week, 10 days, 2 weeks, they start fermenting and developing significant bacterial cultures that will really help boost our immune system. You can do a Google search on fermenting raw foods and find a host of information that will help you in fermenting raw vegetables and giving an economical boost to the immune system. Also, we can use quality supplements. And I say quality supplements. If we're going to use a probiotic supplement, we need to be sure we're using something that is efficacious, something that really works. Dr. Donaldson had gone to great lengths when we reformulated our probiotics a few years ago to find us probiotic cultures that they're not only stable at room temperature for 18 months, but they'll get about a 65 to 70% delivery to the large intestines where the majority of our bacteria recolonize, and they have the ability to recolonize. You know, I see quite a bit of information today. They talk about probiotics, and they talk about how many cultures in a supplement. They'll tell you want to take 50 billion or 75 billion or 25 billion. It really doesn't matter how many billion colony-forming units are in that supplement unless they make it to the colon to recolonize. They have to survive the stomach acidity, the bowel conditions in the small intestines, and get to the colon. With many of the powdered probiotics, powders in capsules and tablets, we do well if we get 10% of those cultures to the colon where they need to recolonize. With the professional strength probiotic that Howley Acres is able to develop, we've got, I believe it's 10 billion colony-forming units in that supplement for the full 18-month shelf life, and we're going to get about 70% of those into the colon. So we're going to get much more benefit from that small amount because of the patented delivery system. That's going to play a positive role in how our immune system responds. I mentioned earlier, we have an immune system from God placed within our body and designed to keep us well. Psalms 139:14 says, I will praise thee, for I am fearfully and wonderfully made. Marvelous are thy works, and that my soul knoweth right well. You know, I submit to you that we were designed by God for health. We go back to the garden, man and woman in perfect setting, no indication there was sickness, illness, no penalty of death until man chose to violate God's one prohibition or one test of his free will, and that was that he not eat of the tree of knowledge of good and evil in the garden. And as we know, man failed that test and sinned and fell under the penalty of sin. But in that garden setting, God provided the ideal way to nourish the human body. And as I said earlier, our diet is fundamental and foundational. We can't bypass that with supplements and various other, even medication and things of that nature. We have to get the diet right to begin with. We want a diet that's nutrient-dense, low in calories, rich in fiber, and we want to put a heavy emphasis on green foods. And we want a minimal amount of sugar in our diet. Our green foods are probably the richest nutritionally. They're rich in not only vitamins but minerals, magnesium, calcium, trace elements, minerals that the average person on standard American diet are really deficient in. Magnesium deficiency is very common. Calcium deficiency is common in the general population, but not among those on the Hallelujah diet. And then it's rich in fiber, which provides the prebiotics that supports the friendly bacteria that we are host to in our colon and helps them to recolonize and to really help provide that defense that we need. We mentioned that we want to keep our sugar intake low. Sugar is a killer. There's just no way around it. Average American is consuming 40 teaspoons of sugar on a daily basis. That's about 150 pounds of sugar annually. 12 teaspoons sugar found in the average soft drink, and when we consume 12 teaspoons of sugar, we impair our white blood cells' ability to kill bacteria by 60%. If we have that soft drink and a candy bar, get up close to 24 teaspoons of sugar, we reduce the friendly the white blood cells' ability to kill the pathogenic bacteria by 92%. And yeah, How often is it you go into a hospital setting, find somebody in the hospital, they're trying to recuperate from surgery or an illness. They give them soft drinks to drink. They give them sugar-sweetened desserts. And we wonder why they get sicker when they're in the hospital. We're destroying the immune system's ability to keep the body well and to deal with the bacteria that they're subjected to. 100 grams or 4 ounces of a refined carbohydrate in the form of glucose, fructose, or sucrose, honey, or even in orange juice will impair our white blood cells negatively. And it begins within 30 minutes and lasts for over 5 hours. At the peak of inhibition, approximately 2 hours, there's a 50% reduction in white blood cell ability to kill bacteria from that ingestion of 100 grams of refined carbs, and that's because they're so rich in sugars. Again, it's impairing the immune system, ability to kill these bacteria. Let's take just a moment and look at this set of questions here. That how often do you get a cold or flu? And this will give us some idea of how our immune system is handling the stresses, the bacterial and the viral influences we come under daily. And if our immune system is at the top of the game, we really shouldn't have a cold or flu. Reverend Malcolm will tell you he's been on the diet nearly 40 years, and to my knowledge, he has never had the flu since he has been on it, and I don't think he's had the cold. And that's the way God designed us to be. We're not to succumb to these viral and bacterial influences. So as we look at our survey results there, we can see that about 50% of us, a little over 50% of us, are rarely, if ever, having colds, but again, nearly 50% of the ones responding have a cold or flu at least once annually. So one of the things that's allowing that to happen is our intake of sugar. And we're at the time of the year, Thanksgiving and Christmas, when we're involved in all of the celebrations. It's difficult to turn down some of those sugary desserts, but when we realize the tremendous impact it's going to have on our immune system, we should be better able to resist those. I believe it was Reverend Malcolm said that when he sees something with sugar in it, he visualizes there's a crossbone and skulls on the container that's containing that. That's just a deadly poison. Sugar uses insulin to get into our cells, but the glucose blood sugar, it blunts the entry of vitamin C into our cells. It prevents the vitamin C getting into the cells. It will inhibit the vitamin C's ability to get into white blood cells. And when our blood sugar is up over 120, it reduces by 75%, again, the white blood cells' ability of killing the pathogens, the bacteria, the phagocytosis. Also, sugar is considered oncogenic. It promotes the development and the spread and growth of cancer. Cancer cells have 15 times more insulin receptors than a regular cell. So when we have blood sugar floating around in the body, those cancer cells are going to gobble it up because they got 15 times the insulin receptors. And we're going to promote the growth and spread of the cancer. One of the other aspects that a lot of us have not been familiar with is becoming more prominent, more knowledge about it in the recent, I guess this past year really, is the role of oil pathology. This can be a tremendous detriment to the ability of our immune system to function as God intended. When we speak of oil pathology, we're thinking of root canals, cavitations. Quite often, cavitation develops when wisdom teeth have been extracted. They don't often remove all of the periodontal ligament when a wisdom tooth is extracted. The extraction site will heal up and it'll leave a pocket that encapsulates that periodontal ligament, which begins to decay, and then it begins to harbor bacteria. And the bacteria just gradually seeps out into the immune system, into the bloodstream and into the immune system, and impairs the immune system after decades of being exposed to this. Same way with the root canal tooth. Every time we chew, if we have a tooth with root canals, There's 30 to 40 different types of bacteria that are found in a root canal tooth, and 30 to 50 in a cavitation. And there's numerous types of bacteria, and they're just constantly leaching into the bloodstream. It can't be helped. Gerson Institute's been around over 60 years treating cancer patients and treating the incurable cancer patients. I always tell a cancer patient, if you got a root canal tooth, get it extracted, get the jawbone taken care of so that it can heal before you ever come for the therapy, or you can't get well. And we're learning that root canals, cavitations, and even the mercury fillings can be a real detriment to the body's ability to heal. They can stress the immune system to the extent that it breaks down and we develop into cancer. Another quick survey here, as we're getting a little closer on our time, and I don't want to go over time, is regarding the oral pathology. If you take just a minute and scan those, mark them quickly, and see where you're at. Yeah. A few years ago, I was acquainted with an organization here in North Carolina that did a thermal imaging of the face. They were looking for evidence of damage from root canals and cavitations from wisdom tooth extraction sites. They never found a lady with breast cancer that didn't have either a root canal or a cavitation on the same side of the body where the cancer appeared. After years of harboring this bacteria and leaching into the system, the immune system just finally got weak enough that the cancer was able to develop, and the immune system wasn't able to fend it off. So something we really need to be aware of, whether it is dealing with common colds, flu, or chronic illnesses such as cancer. Our immune system can be dramatically impaired by our oral pathology. And one of the ways that we can really empower our immune system is through the use of vitamin C. Interesting to note that man, monkeys, and guinea pigs cannot synthesize vitamin C. Just about all other mammals have the ability to do so. We can look at an adult goat, for example, and they have the ability of producing about 13 grams of vitamin C on a daily basis. When they get under a severe toxic challenge, their production of vitamin C can ramp up to as much as 100 grams daily. And, we look at the human being. When we're under stress, we're under a toxic challenge, a viral influence, or bacteria. The only vitamin C we have is what we're consuming in our diet or what we're getting through supplements. And quite frankly, the RDA is less than 100 grams a day, 100 milligrams a day, which is woefully deficient. So we have to rely on our dietary intake from our foods and our supplements. Fred Klenner, often people think of Linus Pauling as one of the pioneers in vitamin C, but Dr. Fred Klenner was probably the greater pioneer, way ahead of his time. Actually had the privilege of meeting Dr. Klenner back in the 1970s. He occupied a small office down in Reidsville, North Carolina, just above the drugstore. He would be in that office often at 10, 11 o'clock at night treating patients. He had such phenomenal results with the way he treated them. He was just bombarded with patients from all over the country. We took my sister-in-law down in the early 70s. She had shingles of the eye, and he saw her one night late, probably at 10, 11 o'clock. He gave her some IV injections of primarily vitamin C, but some vitamin B along with it. Had her come back, I believe it was 2 more nights in a row. After the 3rd night, he told her, said, if you haven't had any pain with it, said, you won't have any. It's been cured. Never had any problems with shingles of the eyes after treatments by Dr. Klenner. He used a lot of IV vitamin C, and we know the benefits of intravenous vitamin C in dealing with cancer. But today, we have a form of vitamin C called liposomal encapsulation. It's the vitamin C particles that's been encapsulated with a small fat molecule so that they absorb very efficiently into the bloodstream and into the cells. They don't stress the GI tract the way typical vitamin C does, the sodium ascorbate or the ascorbic acid you get in tablet, capsules, and powder forms. You can only use those up to bowel tolerance. And it was Dr. Klenner that taught that we should get 1 gram of sodium ascorbate per year of age. So a child, age 2, would get 2 grams. A 10-year-old child would get 10 grams. He said after the age of 10, we need 10 grams daily to keep our immune system functioning optimally. But quite often, 10 grams daily gives a lot of GI stress. It will stress the gastrointestinal system, often create a loose bowel. The liposomal vitamin C doesn't do that. A 1 teaspoon serving gives you 1 gram of C. You could take 10, 30 grams of the liposomal C and have no GI stress. If you can write down this particular website on this next slide, or if you don't get the website, look up Alan Smith and his story with vitamin C. This was a man in New Zealand that was on his deathbed from swine flu. Doctors wanted to remove the life-sustaining equipment he was on. He was on life support. They gave him no hope. His wife and sons refused. They battled back and forth for a number of days. Eventually had to bring in legal assistance to allow the doctors to, or persuade the doctors to give him IV vitamin C. He was in the condition that when they took x-ray of his lungs, they had whiteout. They were so full of fluid, they saw nothing on the x-ray for his lungs. And they saw no hope for him. After giving him injections of vitamin C, I believe it was 50 grams initially, for a few days, and he started improving. They dropped the vitamin C, and he started going backwards. Anyway, they battled back and forth for a period of time, but the end of the story is Alan recovered completely from the use of the vitamin C, regained his health. He had been told he had leukemia as well, and he had no evidence of leukemia. So very interesting story. If you'll get that video up and look at it. It takes about 17 or 18 minutes. I mentioned the root canals earlier. Root canals cause more heart disease and more cancer than any other single factor. This oil pathology we discussed dumps a continual flood of C-destroying toxins and pathogens into our blood, and the coronary arteries being the first arteries reached. And the damage that these toxins are doing to our arteries causes plaque to accumulate and then begin to block our arteries. And it's because of the depletion of the vitamin C that the artery lends itself to arterial scurvy and then ultimate cardiovascular disease. So getting our vitamin C intake up, both through the sodium ascorbate and the liposomal C, can do a tremendous amount of benefit to supporting our body's immune system. Vitamin C is an antioxidant. It's required for over 300 metabolic functions. And you see a quick list of things here that are affected by our intake of vitamin C. Our tissue growth and repair, adrenal function, the health of our gums, the metabolism of folate and tyrosine, proper immune function, protection against pollution and toxins. And it works synergistically with vitamin E, beta-carotene, and the list goes on and on. Dr. Klenner back in the 1940s was using high doses of vitamin C on himself and later on his patients. 1948, during the polio epidemic, Dr. Klenner cured 60 out of 60 cases of polio he treated. 1943 through 47, he treated 41 cases of viral pneumonia successfully. He treated shingles and chickenpox successfully. Just about any type of viral and bacterial infection could be treated successfully with significant amounts of vitamin C. He learned that if we weren't seeing the results, it's because we weren't using the vitamin C long enough, or we weren't using it in significant enough amounts to impact the disease or the condition that we're dealing with. Our white blood cells concentrate as much as 80 times higher amounts of vitamin C than our plasma does. And we need to ensure we have the vitamin C for that extra delivery to the immune system so that we can keep it enhanced. This is just a slide showing the picture of the liposomal C. As I said, this is a new Hallelujah Diet product. 1 teaspoon provides 1 gram of vitamin C. And using 1 or 2 grams of the liposomal C, 1 or 2 grams of sodium ascorbate on a daily basis will go a long way in keeping our immune system healthy. Last month's webinar discussed the benefits of vitamin D. when we have optimal blood levels of vitamin D, which are somewhere between 50 and 80 nanograms per milliliter, we don't succumb to viral and bacterial infections. We keep our immune system healthy. But tragically, most people, again, are deficient in vitamin D, so we need to get our vitamin D levels up to an optimal level. And for most folks, that's going to require 5,000 to 10,000 international units of vitamin D on a daily basis. Dr. Cannell, who has authored the Vitamin D Council, the website, has used vitamin D3 therapeutically at the first onset of a flu or a cold. He has advocated using 2,000 units per kilogram of body weight. 1 pound is about 0.45 kilograms. So you take this dose for 3 days, once a day. And just for illustration, a 150-pound person would use 135,000 units of vitamin D3 one time daily for 3 days. You don't want to take this tremendous amount of vitamin D for an extended period of time, but it can have a tremendous impact on our immune system and helping us avoid the development of a flu or a cold. We mentioned earlier the lifestyle and immune support. We have to get adequate sleep. We have to have moderate exercise. We keep our body properly hydrated, and we have to manage the stress in our life. You know, we can be doing everything right, and stress can overtake us and stress our immune system to the point that we can't get well. So we have to manage the stress. If we're not sleeping well, you know, we need a room that's dark. We don't have light shining, TV on, radio playing, a quiet environment. So the melatonin and serotonin can be produced. If we have trouble falling asleep, melatonin supplementation will help induce sleep. And serotonin can be induced through supplementation with 5-HTP. Melatonin helps us go to sleep. Serotonin helps us stay asleep. Quick survey here. How much iodine do you use daily? This is one other important component of our immune system. And about probably 96% of the population is deficient in iodine. 70-some% of the world population is deficient. And it's probably something we haven't helped enough people become aware of. As I look quickly at the results there, you know, over 50% of the responding here do not use iodine at all. Without optimal levels of iodine, our immune system cannot function efficiently. Iodine is a very important component of the immune system. Before I go further on to iodine, since this little slide has popped in here, garlic is another potent antibacterial, antiviral, antifungal agent. We should consume it raw, crush it before we consume it, but put it in green smoothies, soups that we make in the blender, even use it in stir fries. Even heated, we're going to get some benefit. But garlic should be a mainstay in our diet on a daily basis because of all the benefits. And then back just a few minutes here to our iodine. Iodine destroys pathogens, molds, fungi, parasites. It's been used to destroy and treat malaria. It supports our immune system. It helps modulate inflammation, and inflammation is at the root of most chronic and acute illness. And it improves the ability of the white blood cells to destroy bacteria. Helps reduce oxidative stress. Should be accompanied with about 200 micrograms of selenium on a daily basis to help support the thyroid and to help maximize the use of the iodine. Selenium, we mentioned, supports the thyroid and the use of the iodine. It's vital in the production of glutathione, which is our body's master antioxidant, and it plays a vital role in the development and activity of our white blood cells. Deficiency of selenium results in a depressed immune system. B12, deficiency of B12 can also reduce white blood cell production and impair our immune system. Vitamin B12 is a fundamental part of the Hallelujah diet. Everybody on the diet should be using it unless they know from testing that their B12 levels are in an optimal range. Likewise with iodine, it should be a fundamental part of the Hallelujah diet, something that we're using on a daily basis. Silver Biotics is another supplement that I keep on hand for particularly myself, my kids, grandkids. American Biotech has produced the only patented silver ion I am aware of. It's a silver solution, not a colloid. It's very safe. It doesn't accumulate in our body. It's the only nanoparticle solution with multiple modes of action that we're aware of. Has a tremendous history. Silver has a tremendous history of successfully supporting our body in dealing with bacterial, viral, and fungal issues. Then finally, something we can use also to give our immune system a boost is beta-glucan. We can take beta-glucan, 1,3/16 glucan, 250 milligrams once a week between meals and without any food to give extra support to the immune system. During peak flu season, we can take it up to twice a week. We don't want to take it on a daily basis because it keeps the immune system ramped up, and we don't want to keep it overly stimulated and ramped up without a specific challenge that we're dealing with. I mentioned the therapeutic use of vitamin D3. Hallelujah Acres will be making available vitamin D3 in the 50,000 international units for those of us who choose to use it therapeutically. The beta-glucan transfer factor point, I believe, probably has about the best beta-glucan available. You can find sources for that on the internet. We've moved along here pretty quickly. Our time has run out on us, but you can see from a quick summary here, lifestyle and diet are fundamental. Our genetic makeup does not have to dictate our health, nor does the lack of having a normal childbirth and being breastfed. We can do things to overcome the genetic influence and the deficiencies that have developed from the way we were born or not nursed. The important role of our friendly bacteria, the damaging effects of sugar, the killer that it is, and then the negative impact oral pathology can have on our immune system and our ability to heal. And then you see the list of some supplements here that can really give our immune system a boost. With that, we're going to wrap up the presentation and take just a few minutes here if you've got some questions that we can deal with.
Sure, Olin. Thank you so much for the great information, and we do have a number of questions. Before we get to the questions, we'd like to announce the winners for the product that we're giving away with this webinar: Donna Joseph, Larry Rennick, and Rachel Lubb. You are the winners this evening, and you should be receiving the product here shortly. And you've got a lot of questions here, Olin. So when we look at several of them, they relate to the oral pathology. And if somebody has a root canal, what do they do? If they've had teeth extracted, how do they know that something's wrong without until cancer comes? Is there some way to check? So several questions around that whole oral pathology area. Can you give a little bit of insight into that?
Yeah. Well, bottom line, there is no safe root canal. Dr. Hal Huggins examined root canal teeth that he extracted for a number of years, never found a root canal tooth that didn't have at least 30 type of bacteria in it that constantly were leaching into the system. So the only option with a root canal tooth is to have it removed. There are some options for like a bridge or even an implant, but if we do an implant, we want it to be a non-metallic implant. Metallic implants can impair the meridians throughout the body that are related in the area where that tooth was extracted and the implant put in. Bridges are a good option, but you really need a good holistic dentist. I've got a list of a few dentists that if you want to send an email, I'll send it to you, anybody interested. But root canal teeth really need to be removed. Wisdom tooth extraction sites, about 85% of them develop cavitations, and again, you need a good biological holistic dentist that knows the dangers of cavitations and has the ability of looking for those. The digital panoramic x-ray will often reveal those to a dentist that's trained in detecting them. And also, they may also need the benefit of a thermal image of the face. And there are a few places around that will do a thermal image of the face and can work with a good dentist in detecting those cavitations. And it's a simple procedure to repair them in the dentist's office with a knowledgeable dentist. But usually, they'll do a little surgical procedure, a little incision in the gum, drill a little hole in the area of the cavitation, and quite often they'll see the dark pus that drains out of that cavitation from the infection. So those both issues really need to be handled, and you need a knowledgeable dentist to do so.
Another question, and I think it's a theme as well, several places require flu vaccines now, and if somebody's required to get the flu vaccine for their employment, are there any supplements that you can recommend, or how do they overcome the conflict there?
One of the best things we can do, if we're going to have to end up getting the vaccine, is using the vitamin C, particularly the liposomal C, quite aggressively. It's very influential in getting toxins out of the body. Dr. Klenner treated, I believe it was 3 kids that were playing on the field back in the 40s, and they got sprayed by a crop duster. He treated one of the kids with massive amounts of vitamin C. The other kids went the medical route. The 2 kids who went the medical route died. The one Dr. Klenner treated with no adverse reaction. So the vitamin C is tremendous in helping getting these toxins out of our body and supporting our immune system. I think that would be the most important thing that we could do if we have to take a vaccine.
Cynthia says she's very allergic to shellfish, and she heard that iodine is contradictive for her. So any thoughts on that?
Usually folks that have a problem with shellfish, it really is not a true iodine issue. If a person can consume iodized table salt, generally they will have no trouble with iodine supplementation. Do need to start with iodine slowly and work up because iodine can mobilize heavy metals, and you can get a significant headache or detox reaction if we take too much too quickly. The nascent iodine that Hallelujah Acres provides is one of the best forms. It's elemental energetically charged iodine. Does not contain potassium iodide or ammonia iodide. It's just pure iodine. 3 drops provides 1 milligram of iodine, starting with 3 drops in a couple ounces of water first thing in the morning, and then gradually working up to the desired level. But most folks do very well and have no reactions to the iodine. The folks that have problem with the iodine used in nuclear medication generally don't have any problem with the iodine, particularly the nascent iodine.
Michael asks, is there a place for juice fasting in helping to boost the immune system?
Juice fasting can be very beneficial, I think, in supporting the immune system and healing. Would not encourage anyone to do juice fasting unless they've been on the diet at least 6 months. Juice fasting prematurely can cause too rapid of a detoxification, and breaking the fast improperly. Sometimes folks have come off of a fast like that who had not been prepared for it, and they were worse shape afterwards than they were before. So if it's a properly controlled juice fast, it can be beneficial in giving the body, the digestive system, a rest and providing an abundance of nutrition that will support us during the healing, and it will help keep us hydrated. So one of the other important aspects, particularly when we're dealing with a cold or flu.
We've had a couple people ask about children. So we've talked about immune system support and therapies almost for adults. What would you do for children?
Children can use all of these things on a reduced level. Children should be getting iodine supplementation. 2 or 3-year-old child should be getting 1 or 2 drops of nascent iodine on a daily basis. Iodine has a tremendous impact on the intelligence. Kids that are born from moms that were iodine sufficient have a higher IQ. They can use the silver. Silver can be used with very young children. One of the tremendous advantages of silver biotics is you can use it aggressively. You can use it freely, several times daily. What we consume today, it will be utilized in the body and eliminated within 24 hours, so it doesn't accumulate. So I've had no issue using silver biotics with children as young as 4 or 5 months of age. can be used for eye drops, ear drops, nose drops, tremendous benefit. Vitamin D, children's blood levels of vitamin D ought to be up in that 50 nanogram range as well. They may need 2,000 units daily. So the vitamin C, again, can be used very freely with children. So all of these things can be used with children, and most of the children today, they have a need for them at some level. Selenium, we may not be able to use one daily, but, 6-year-old child, use a selenium once or twice a week. Same way with the B12. So they just need reduced levels or reduced frequency of some of these particular supplements to benefit from them.
Sounds great. Well, we sure appreciate all the information and wisdom that you shared this evening, Olin. Anything you want to share as we wrap up?
No, we've gone through this pretty quickly. If there are lingering questions, folks can send an email, and I'll try to get back with a response to them, and also give them some information like the links to the doctors and some information on iodine. We have some good, useful information. We just need to get back to folks that are interested in it.
Sounds great. And this call and presentation has been recorded. And we will send out a link over the next couple of days so it can be downloaded and reviewed, because there's so much information here. It's pretty hard to get it all at one sitting. And as you said, Olin, our customer service is there to help. There were several questions we weren't able to get to, or they were just a little bit off target for what the presentation is, and we'll try to get all those answered and get you some responses back. But we appreciate your time this evening, Olin. And thank you for everybody who signed in today and participated, and pray that we were able to provide a blessing to you. Thank you, and have a great night.
Thanks, everybody.